in this area affiliated with FEC. There's no reason for us to recreate the wheel. We're going to jump on their coattails and ride them. So we will be communicating about that in our group very soon. We've been working on it, and you'll get some information. So now's the time for you guys to meet our keynote speaker. Mark Patlin is the attorney representing Donna Walter and Mark Milliman in their constitutional challenge against Governor Polis's mask mandate. He is a recovering Texan who turned Larimer County redder when he and his wife moved here to escape California a few years ago. So Texas, California, Colorado, he's here. So he's escaped California to be back in California practically, but we're going to change that. Mark is an attorney and businessman. He and his wife have run successful consulting businesses for 30 years, helping U.S. and international defense and scientific contractors to manage billion-dollar programs. So not only is he a lawyer, he's a businessman. He's going to be very helpful to us. He's a licensed attorney, house counsel, and experienced business litigator. He studied law to serve in the public interest to protect our fundamental rights. Thank you. He's provided pro bono legal assistance to the poor. He was an Orange County Republican activist for many years. He helped to elect good Republicans in their primary wins over rhinos? Rhinos, sorry. See, I'm not an activist. I told you, I'm learning. He was part of the California tax revolt movement 10 years ago, acting as the attorney for recall campaigns targeting other rhinos. Today, he's happy to call himself a Coloradan. He's happy to stand shoulder to shoulder with us in the fight to protect Coloradans, our Colorado way of life, our Constitution, our freedoms, and our faith. Please welcome Mark Patlin.
Yes, I am a recovering Texan. And it's actually nice because the first time I came to Colorado, I went out to Colorado Springs to visit Falcon Air Force Base. And on the flight, a Coloradan was sitting next to me, and he was telling me how Coloradans really hate Texans. And I didn't understand that. I didn't ski, so I didn't understand what was going on there. But anyway, I'm Mark Patlin. And I'm not Sheriff Justin. I put together something to explain our lawsuit over the mask mandates. So I represent the plaintiffs in the mask mandates, Donna Walter and Mark Milliman. It's a misreporting about the lawsuit. There was a KOAA news story about it where it said, Mark Patlin said the lawsuit is symbolic. Well, it's not symbolic. It's not symbolic at all. When I filed it in the federal court, I swore that it wasn't symbolic in the first place. But it is about compelled speech. It's about symbolic speech, and that's a little confusing, and it takes a little explanation to understand what the lawsuit is about. Well, the main thing the lawsuit is about, it's about science, okay? So I'm going to explain it, what it's about, why we're pursuing the lawsuit. So it is a constitutional challenge. It's a civil rights lawsuit. And it's a First Amendment free speech challenge. And as part of the civil rights lawsuit, one of the things that we're alleging is that Governor Polis is coercing business owners into enforcing this unconstitutional mandate. And that's a problem, see, because under our civil rights laws, businesses who are enforcing unconstitutional laws, they can face financial liability. So you remember back before the mask mandate, Polis said, well, I'm not going to issue a mask mandate because I don't have the authority to do that. I can't enforce it, he said. Well, what he did was he expanded on another executive order and he made it private enforcement. So it's private businesses that are enforcing it. And he's really put businesses in another lose-lose situation. So it's like you can enforce the mandate and stay in business and keep your doors open and potentially face financial liability, or you can close your doors. And Jared Polis has not been good for business. And you know, I'm a business owner. I'm a small business owner. The lockdowns affected us. You know, we mainly work with government contractors. But the lockdowns affected us because they hit California first, where we do a lot of work, and we weren't getting paid. So when those paycheck protection loans came around, we were sweating. We were really sweating, like a lot of businesses, whether we were going to make payroll or not. Well, that's the situation that our small business owners face. And when we talk about protecting vulnerable populations, that's a population we need to protect because the state doesn't seem to care very much about it. And, you know, when we talk about these businesses, that's people's lives. That's their livelihoods, that's jobs, that's families. And, you know, what we heard touched on already was the problems that causes. It causes addiction, suicide, families fall apart. Anybody who has ever suffered that kind of situation, you know how hard it is, or if it's happened to somebody you know. It's very, very hard. And that's one of the reasons that we all need to join together to fight these things. And that's the reason that Mark Milliman and Donna Walter decided to file this lawsuit, because somebody has to stand up for our business owners and our families. And so, you know, that's what we're doing. So the question is, you know, what do mask mandates, these masks, what does that have to do with the Constitution and free speech? Okay, so what we're saying is that the face coverings are symbolic. They're not effective. They don't do anything. So, you know, it's like I have this face covering right here. Okay, this satisfies the requirements of the mask mandate. Does this stop the spread of a virus? No, it's ridiculous. Of course it doesn't. So then what is it? Well, yeah, it is fear. I think fear is right because, you know, they say that the masks help people feel more safe. I don't think they make people feel more safe. I think they make people feel endangered. They feel less safe. They're scaring people. So, you know, people have said this lawsuit is it's about publicity, which we haven't sought any. So if it's about publicity, then we're certainly failing at that. You know, we are speaking to groups like this, but it's not about publicity. You know, when I agreed to present after talking to Julie, I told her, you know, this is really the lawsuit is not what I want to be doing. I moved to Colorado because I love Colorado and I love Coloradans, and I would like to sit at home with my wife and my dogs and enjoy the scenery. That's what I would rather be doing. But you know, we have to do what we have to do. You know, we have to rise to the occasion, and that's one of the important things about this meeting today is that we do have to organize and we do have to come together to work against these things, because nobody is going to come in and save you, right? You have to save yourself. You have to save your neighbor. You know, it's like when you see businesses being closed down. Well, you know, first they came after oil and gas, right? And people, I obviously oppose that. But people, you know, they thought, well, you know, that's oil and gas. That's those guys. Well, but now who are they coming after? bars, restaurants, small businesses, they're always going to come after you next because they don't particularly care about you. In fact, maybe they don't even like you. But this lawsuit isn't about motives either. It's not, we're not saying that this is about control. What we're saying is this is bad science. And, that was one of the other claims that people have made is, well, you're anti-science. If you're against masks, you're anti-science. No, this is very pro-science. What we're asking for is to see the science. So we say that face coverings are symbolic, and we're asking the state to prove with reliable scientific data that they work. We're asking the state to prove with reliable scientific data that healthy people spread COVID. Think about that. My mask protects you from me, even though I don't have COVID. And your mask protects me from you, and you don't have COVID. And that's what they're claiming. Well, obviously that's pretty absurd. And it means they're also claiming a couple of other things. They're claiming healthy people spread COVID, and they're claiming that a bandana or a scarf or other non-medical face coverings prevent it. And they claim they have the science to back that up, and we're saying show your work. We want to test those questions, and that's what the suit is about. So what does that have to do with free speech again and the Constitution? Because it's not obvious, but it's actually very simple. So if the masks don't work, they're symbolic, like we said. And the state can't compel you to wear a symbol. They can't compel you to wear a political symbol or a religious insignia. That's compelled speech. And the First Amendment protects your right to speak, and it also protects your right not to speak. And the First Amendment protects you from the state making you its messenger. And this is well-established law. I mean, can we make students in school stand up and recite the Pledge of Allegiance? No, we can't. Why? It's compelled speech. So, but we can compel people to wear this, right? No. So that's our challenge. So, and like I said, make no mistake that the masks carry messages. They carry two messages at least, that they're necessary and that they work. So see how simple that was? I said it's simple, but it's not obvious. So, that's how simple the argument is, and it really comes down to two tests. And, that's what our lawsuit is about. It's about those two tests. So let's go back to those questions again. Do healthy people spread COVID? And does a bandana or scarf prevent it? Well, no, of course not. I mean, that doesn't fit common sense. It doesn't fit reason, and it doesn't fit well-established science. So, that's one of the interesting things that's happened with COVID is that, all of the science that we had before the year 2020 seems to have evaporated and been replaced with new science, okay? Because there was science about masks. There was science about asymptomatic spread, which is what they call it. And they're not paying attention to that science. So, how did that happen? Well, the science behind mask mandates it's really junk science, right? And so let's talk about junk science, because to understand the junk science behind mask mandates, you have to go back to the lockdowns, and let's look at the junk science behind the lockdowns. So some of you may know this, and some of you may not. So if you know it, I apologize. But the junk science behind lockdowns started with a computer model. So you hear a lot about models. Well, our models say this. Public health experts say this, based on models. Well, it started with a model at UK Imperial College. And that model predicted 2.2 million Americans would die without lockdowns. And Doctors Fauci and Birx relied on it. They relied on it to sell lockdowns to the president. And the Imperial College was garbage. It was garbage. They were pressured to release the code for testing. And they released the code after Microsoft and Google engineers had a chance to try to clean it up some. They couldn't fix it. The thing with this model was you couldn't run it twice with the same inputs and get the same result. Well, that's pretty obvious, right? It's pretty obviously a bad model. So that same model predicted 500,000 Brits would die of COVID. A week and a half later, the author, Neil Ferguson, reduced that to 20,000. So he went from in a week and a half, from 500,000 to 20,000. That's 4%. 4% of his first prediction. And this was used to justify our lockdowns. So what about the predicted 2.2 U.S. deaths? Well, what's 4% of that? I had to get my calculator out, of course. You know, it's 88,000. And so how many U.S. COVID deaths do we have? Well, we don't really know. You know, it's actually hard. It's hard to know. It's hard to know, really. They say 150,000. Could probably less, but we don't know. But what do we know, right? We know, what do we know about COVID deaths? We know that it mainly kills the elderly and the sick. The median age is around 80. Now, if you're like me, there was the mean and the median and the mode in math, and you guys know. Okay, so the median is the middle number. So it's not the average, it's the middle number. And so what it means is that if the median age is 80, it means it killed as many people over 80 as it did under 80. Well, what does that tell you? It tells you that it mainly kills the elderly. And in northern Italy, where they had a very high death rate, median age is around 100. Northern Italy is beautiful, too. I really had recently been there before this happened. So those are the vulnerable populations, though. Those are the vulnerable populations we're supposed to protect. Well, did lockdowns protect the vulnerable populations? They didn't. You know, New York, Governor Cuomo, he did the opposite of protecting the vulnerable. He sent infected patients into nursing homes. And so that's why most U.S. deaths are in New York and New Jersey. And death per capita, they lead the world, right? So when we talk about, you know, they'll say, well, if you don't wear a mask, you're going to kill grandma. Well, no, you know, it doesn't protect grandma. This doesn't protect grandma at all. In fact, I'm going to go into a little more about the lockdowns and talk about grandma. But let's go back to the vulnerable population. So science is known for 180 years that epidemics strike these vulnerable populations. 180 years. 180 years ago, there was a British epidemiologist named William Farr. And he was a statistician also, and he observed smallpox and epidemic data. And what he found was that epidemics follow a pattern where deaths rise and fall in a curve, kind of a normal curve, mainly killing the elderly and the sick and killing them first naturally. So you'd be surprised, or you might be surprised to learn, this was the pattern we saw in Arizona. You know, we saw in the media a lot of reports about the surge in Arizona and ICU utilization, not enough ICU beds. But you know what Arizona did? They didn't lock down again. And do you know what the death pattern followed? It followed that same curve. And it said, what that tells you is that left alone, I mean, and still protecting the vulnerable population, that COVID would follow the same pattern, okay? Because that's what we've observed. I mean, that's what we've observed here, and that's what we've observed in other countries. And other countries, that's important because there are countries, right? When you look at the news coverage of COVID, it's very focused on the U.S. and U.S. public health experts, and it ignores the rest of the world, even though there's a lot of data from the rest of the world that tells you so much about this and why things like the mask mandates are unnecessary and why lockdowns were unnecessary. So, and maybe that's why the CDC issued a pandemic guide in 2007, and it said these things. It advised against lockdowns because of the social and economic costs of lockdowns. It also warned against using computer models for policymaking. And it warned that public health experts and politicians can be swept up in a panic, right? So, again, when we look at what's happened, we see that. We see that public health experts and politicians have gotten swept up in panic and done a lot of damage to society and to the economy. So interestingly, that also included a category system for epidemics. I grew up on the Texas Gulf Coast where we would get hit by hurricanes, and they're categorized like Cat 1 to Cat 5 hurricane. Well, they set up a similar scale for epidemics. And so Category 1 is your average flu. Category 5 would be the Spanish flu that killed millions of people, including young and healthy people. So what would COVID be on that scale of 1 to 5 if you had to take a guess? 2. It's a 2. And when you look at the measures recommended by the CDC and also by the WHO in 2019, no lockdowns, nothing approaching what happened in March and what's happening now. So why would we then have a mask order issued at the end of this thing? I mean, you remember the lockdowns was to flatten the curve, and what does that mean, flatten the curve? What that means is it's to reduce the rate of infection. So it's a measure, it's called R0. Maybe you might remember there was a Jared Polis press conference, and he said, he says things and he sounds very sure of himself, and it's based on science. And he says, and this could have an R0 of 4. And that was the prediction, actually, that came out of Wuhan, China. We don't know how reliable that data is, but we do know that Wuhan was a dense urban area. So when you look at the transmission of viruses, they transmit more quickly in dense urban areas. And lockdowns actually do more harm than good, and here's why. So I talked about grandma. Now, I say that, but my own mother passed away during the lockdowns, and so we got to experience the, luckily my brother was on staff at the hospital, so he had a phone. He got in to see her, and we all got to say goodbye. Many, many people didn't. And then they weren't able to have funerals. And, I flew back to Texas, and we had the funeral, and the funeral director said, well, the fire marshal says you can't have more than 20 people in here. I said, well, you let me handle the fire marshal because I'll make him nationally famous. So, and, because my mom was the role model of a Christian. She was truly the role model of a Christian, and even though the church wasn't supposed to send anybody out there, all the pastors came out, and we had a huge crowd, and we totally ignored the guidance that we were given. But the thing about the lockdowns is the lockdowns kill people. Okay, one of the things that happened, and it wasn't to my mom, but actually it was, but people were so afraid to get care that they wouldn't go to the emergency room. We expect a certain number of heart attacks and strokes. They're kind of the bread and butter of what goes on in hospitals. They happen all the time. And all of a sudden, they disappeared during the lockdowns. Where did they go? Well, people died at home. And, I mentioned my brother's a doctor. He was doing telemedicine, and a patient didn't show up. They didn't appear for their telemedicine call, and really bored. Nobody's coming into the clinic. Everybody's locked down. This patient hasn't shown up for their telehealth visit, so he got bored, and he called. He called the patient's house, and he spoke with the patient's wife, and the patient's wife said he had been having seizures for 2 days, and he had been lying on the floor unconscious since Saturday night, and it was Monday. He said, "Ma'am, call an ambulance. You have to call an ambulance." "But we're afraid of COVID." "No, you have to call an ambulance." He was sure that he was going to die, that the patient was going to die, and amazingly, the patient lived. Okay, because my brother got bored and reached out to the patient. Okay, so that's the kind of things that happen with these lockdowns, and they were based on junk science. But what we've learned is that the lockdowns didn't work. Okay, the lockdowns have no effect. And when you look at the CDC guidance and the WHO guidance, whether from 2007, 2017, 2019, what it says about all these measures is, it asks, are they effective? And it says, because it's an epidemic. It's an epidemic, and they follow the curve that they follow, and there's not that much you can do. You can protect, elderly, vulnerable populations. So now that we've gone through that and relived that, so lockdowns were based on junk science, and they cost lives, and they caused enormous harm. So now that brings us to mask mandates. Do masks work? Well, no, they don't work, and there's no reliable scientific data to prove it. The WHO's leading epidemiologist on COVID, Maria Van Kerkhove, she came out at the end of June and said there is no reliable scientific data to show that to show that there's asymptomatic spread. Because that was the thing. Asymptomatic spread, that's the argument for healthy people wearing masks. Healthy people need to wear masks because there's asymptomatic spread. That's their argument. There's no scientific data to support that. And like I said just now, Maria Van Kerkhove, the WHO's leading epidemiologist, has said there's no reliable data for that. And she was criticized. Now, wouldn't that be good news? That's good news. Okay, healthy people aren't spreading COVID. Hooray. Well, how come with COVID, good news is bad news and bad news is good news? Because that's good news. And she was criticized for it. She had to kind of walk it back. But when she did, she was criticized by the computer models that said, oh no, that's responsible for up to 40% of spread. And she said, no, that's just computer models, right? So again, with the masks, Is there asymptomatic spread? Do healthy people need to wear masks? No, they don't, and there's no scientific data for it. Now, and do the masks work? And then you'll see, and that's a confusing question because, you know, there are masks, there are medical devices, there's PPE, which can prevent the spread of viruses when used properly, typically in a medical setting. But this is not PPE. Okay, that's not PPE. That's not going to stop the spread of anything. And so, you know, does that work? Is there reliable scientific data for that? No. And when you look at the data for that they offer, it's either computer models, usually based on data out of Wuhan, China. And again, we don't know how reliable that data is. Or it's studies of studies. So that if you ever hear, like Dr. Fauci say, meta-analyses, he says meta-analyses show that, you know, maybe you should wear goggles, right? Well, you know, a meta-analysis is a study of studies. And when you look at them, what you'll find is you'll find a bad study or computer model, and then another couple of studies based on that, and then more based on that, and then more based on that, and then they claim, look at this emerging scientific data. It's like, no, that's not emerging scientific data. It was junk science when it started. So, you know, that's why we're suing, and that's why we're fairly confident that we might prevail. Because it is about science, and it is about the Constitution. And we do need to join together and stand up to fight these things. So, you know, that's it for my prepared remarks on this. You know, it is about science, and thank you.
Thank you so much. He agreed to do this morning. So, yeah, last night a reporter from Reporter Herald called to talk to me about our event and informed me that Sheriff Smith wouldn't be here. And I said, oh, really? I haven't heard that yet. So I thought maybe it was like a fraudulent report or something. And that made me start wondering, what are we going to do? Is he really not going to come? So my mind was churning all night on who I could ask to speak. It all came together. Yeah.
Because right now, all of our lives are at risk, right? Our businesses are at risk. We're hearing these stories of people at risk, and the sheriff...
Come back here.
And the
It'll
sheriff...
screech if I go forward.
Our last line of defense against authoritarianism. Our last line of defense against authoritarianism is the sheriff. And he doesn't have the courage to stand here with us tonight. That, for me, is disappointing. Yeah. How many veterans are there in the audience? Raise your hands. Let's give these guys a hand. Yes? Okay. This is not the country that you fought for. Damn right you aren't. It's not. That's what we're all fighting for right now. That's why we all came here today, because of the acts of freedom. Because there's tyranny against us as people. Okay? And we need to have courage to speak up, to stand up. And let me just say this. I would disagree on many things with people here. I'm not Republican. I'm definitely not Democrat. Okay? I'm not. But when I see atrocities against our people, when I see tyranny against our freedoms, it's not fighting against one another. It's not fighting against these boogeymen that they're creating. There is no Antifa. There is no right wing. There is no left wing. We're in here together to fight this tyranny together. So what I would encourage you, our last line of defense, again, this is why I'm here today, is because I was hoping that the sheriff would have the balls to stand with us, to say, you know what, if my friend, if his business shuts down, is getting threatened to be shut down, if we're getting threatened to be arrested because we're not putting on a goddamn mask, that we would be defended. Honestly, I don't think, the attorney that was up here, honestly, we need much more teeth in our convictions and in our stance against this than what the attorney has. And us together, we can do that. So that's all I have to say.
Thank you. I love the passion, and we need that. We need